Health experts are urging people to stay up to date with their measles vaccines amid a growing outbreak that has hit eastern Ontario. Measles cases continue to rise in the province, with Public Health Ontario seeing more than 1,000 cases since October. One of the latest confirmed cases is in Renfrew County. So what should you be on the lookout for, and what can you do if you get sick? We've paged Dr. Paul to explain. Welcome back to CTV Morning Live, Dr. Paul. Great to see you again.
Nice to see you.
I know our viewers don't necessarily have an opportunity to watch every day, and we've recently spoken about measles, but right out of the gate, just remind us of what it is and how it presents itself.
Okay, it's a virus that spreads from person to person, just like a cold.
Okay.
Unlike a cold, although it starts like a cold, gives you red eyes, fever, and then a rash develops.
Okay.
The rash develops in the face, and then to the rest of the body. Now, people would say, well, no big deal, right? No. The problem with measles is that it can get into the blood. It can actually cause lung infections and brain infections.
Oh my goodness.
And even death. So that's the difference between just a regular rash, regular virus, and the measles virus. That's why we're lucky here in Canada. We have vaccines to prevent it.
Yeah.
And really, for the most part, we're going to talk about, if your child gets a rash, should you worry about measles? If the child has been fully vaccinated, you don't have to worry about it. That's the sort of bottom line.
Right.
But it is something that we see. And it's highly contagious. That's the other thing.
Yeah, I was about to ask about the rate of transmission or how quickly it can spread.
If you get a cold or you get a flu, you can spread it to a couple of people maximum.
Right.
If you get the measles, you can spread it to 18 people.
Wow.
So imagine now what's happening in Ontario. In a lot of the cases, we only had one case in real Eastern Ontario. Renfrew is one of them. And that's a person that traveled. But in areas where people are not fully vaccinated, there are pockets of the population, for other reasons, communities, that they have decreased rates of vaccination or no vaccination at all. So one person comes in, they meet at school, they go to community hall, whatever, 18 people get it, 18 other people get it, and that's why you're seeing those numbers rise.
For sure.
And so what we're trying to say is that if we have a lot of the people or most of the people vaccinated and protected, you're going to protect most of the population, so the virus won't have a chance to spread from a person to another.
That's rapid fire infection rate. Is it difficult to diagnose, especially with the naked eye, I guess?
Yeah, it is difficult. There are some signs, but not all viruses, not all rashes are the same.
Right.
Not all just because you have a rash. So you get a fever, cough, runny nose, red eye conjunctivitis, Koplik spots or Riedel spots in the back of the throat, and the rash appears. However, a lot of other viruses...
That sounds very similar to other viruses I've heard of.
Exactly. So we have to have our index of suspicion. So when we're looking at a child or a person comes in, first of all we ask, have you been vaccinated or not? If you've been vaccinated, you're really protected almost 100%, so we'll worry less about measles. But if we are worried about measles, it's hard to make the diagnosis just by looking at you, right? So we do blood tests and urine tests, and that'll help us. But in general, I can tell you, Stefan, 20 years ago we eradicated measles.
Yes.
We had no measles. So now we're seeing an increase. So yes, parents should be aware. So the thing that I think parents should know is that if their child is vaccinated, the 2 doses, one at 12 months and one at 5 years of age, they're protected 98, 99%. And even that small percentage that's not protected, if you get it, it won't be a big deal. It'll be less. But if your child is up to date, or that's fine. If your child's not up to date, make sure that you're up to date. And secondly, people who are born before 1970, because I get that all the time, most people who have been born in 1970 have had measles in the past because there was no vaccine. So you're safe.
Okay, so there's a level of natural immunity that's built up in...
Yes, for people who are exposed to it. Yes.
Okay, because even when I was younger, it was like chicken pox was a thing of the day and mostly affected children, and everyone, the adults seem to have immunity to that. Okay, and the last thing I want to ask you, just very quickly with the time we have left, you talked about the most severe outcome.
Yes.
So left untreated, how quickly could that take place?
You know what? It takes a couple of days for it to build up.
Yeah.
Within a week, you can get very severe complications.
Wow.
In fact, out of the 1,000 cases we have, about 7% are admitted. There's 70 children admitted to hospital.
Wow.
That gives you, it's a very high, high rate of admission to hospital for pneumonia. Unfortunately, there's no treatment. And it's just supportive. And unfortunately, we haven't had it in Canada, thank God, but there have been a couple of deaths in the United States. So it could be very, very dangerous.
Okay, Dr. Paul, thank you for this. That's a very stark warning, and we will not take it lightly.